All right, so this is going to be the last section of Module 1. We're going to cover EMS research and evidence based medicine. Some initiatives and resources that promote EMS research include the Federal Interagency Committee on EMS, National Highway Traffic Safety Administration, the National EMS Information Systems, the National Institute of General Medical Sciences. This coordinates research efforts and promotes ideas for funding. So, practical use of research in EMS. Basically, everything we do in West Virginia is protocol driven, and those protocols are based on evidence based medicine, which is where the research comes in. So, research is needed to provide the best possible patient outcomes. It is supported by evidence, supported by expert experience, gives departments an idea where they may need to focus more training, such as CARES in action, shows the need for complete and accurate documentation. Um, Before basically every year or two, a couple years, we'll have like a new protocol update or rollout, where we'll change how we've done things. Like when I first got started, everybody who had chest pain was high flow O2, 15 liters nasal cannula, like we talked about before, right? Well, now we don't. They've done the research and they've done some studies, and I figured out that it doesn't quite work. It causes more harm than good. And one of the first lessons we learn in EMS is to do no harm. So basically, the research process is you got to choose the topic, conduct a literature search, develop a question, or formulate a hypothesis, right? So, choosing the topic, what question do you want to know? You can start with a broad idea, but must narrow down your idea to a focused idea. Then you do your literature search, which is where you discover what has been researched on this topic. Information found will help formulate your hypothesis, and that's where you'll one attempts to approve or disprove the hypothesis. That's kind of where you're going in the direction of your research. So you come up with a specific statement, um, and what the researcher wants to happen or expects to happen, and it's based on the question and the research. So you come up with, does, like that same example, does high flow O2 help or worsen the patient's condition in acute coronary syndromes? Well, they did the research and they figured out that the answer is, that it actually caused more harm when they answered the question. So that's basically, in a nutshell, how it works. Then implementing the study, collecting the data. This is the actual study process. If multiple people are collecting data, it needs to be reviewed frequently. Careful. You need to carefully watch data entry. Make sure that you don't, transpose numbers or fat finger or something. So you just got to be very careful with data entry, because if you get that part right, that's going to make analyzing that data much easier if it's in there properly. Then you analyze the data. Some calculations can be reported in the raw form. Statisticians may be needed for detailed calculations. So it can get pretty detailed. Then you report your findings. This is, you start with an introduction. You give detail of your methodology, how you went about it. You want the findings to contain the results. You want to give a factual presentation, not your opinion, and discuss the ramifications or the results of that test. How is it going to make your field better or worse? Or how is it going to make that procedure better or worse? There's different research methods you need to be familiar with, quantitative versus qualitative measures. Quantitative measures numerically, you can actually put a number on it, it's objective and it's specific. Qualitative is measured descriptively, it's, is it there or not? Doesn't care about how much is there, just is it there or not. It's non-specific, it's less objective and more subjective. Perspective and retrospective studies. Perspective starts now. You examine from now on. Can make sure everything gets recorded. Monitor the measurements are consistent. Make more time or take more time to complete the study. Biases of the data collectors may be involved. Retrospective, this information already exists. You're basically data mining. You're going back and you're getting the data that's already been collected. It does reduce your time because you're not actually going through the entire study right now. You're going through studies that other people's done, and you're analyzing that data. So it shortens your time, and you're pulling out helpful information that may not have been recorded at that time. So your literature review, why do we need to conduct a literature review? This helps us discover what has already been published. We don't want to keep putting the same information out there over and over and over and over. We want to know what they've already done so we can build on that. So we're able to gain knowledge about the topic, review science about the topic, help build a case for our project, it helps us avoid running into the same difficulties as others who have performed the same study. Finding the literature, most common way is doing a computerized search. We can reference the librarian or personal reading. Computerized, this is one most frequently used nowadays. Computers are found to be found in most libraries, and they have databases that we can research by keywords and phrases. Websites can also be used. The reference librarian is a source for finding reference material. Trained in the latest techniques for conducting searches, can assist in getting information from another library if needed. Personal reading, read as many articles and journals as possible related to the topic. It's a great way to learn about research methodologies and the topic of interest. Helps gain more access to material relevant to the topic. Some examples would be like the GEMS magazines, EMS World, PubMed, Pre-Hospital Emergency Care, Annals of Emergency Medicine. The CINAHL Complete is another good database to look at. You want to narrow the search down as much as possible. For example, hemorrhage and blunt trauma. Searching each of these alone will bring up numerous articles and publications. You may need to type hemorrhage and blunt trauma to find those articles and publications containing both keywords and phrases. Find as many resources as possible. Only exclude those you are positive do not relate to your topic. Look at the reference page of the articles and publications for more sources as well. So you can see what they use to come up with their article and go pull that information as well. Textbooks are a great source of information. Letters to the editor can also add insight to the research project. Bibliography pages are needed for all references, sources used for the project. We always want to make sure we cite what we're doing so that it doesn't appear to be plagiarized or trying to take someone else's work and count it as our own. So, evidence-based medicine and practice. What is evidence-based medicine? That's basically what we practice in West Virginia. Evidence-based medicine is an approach to medicine or medical practice intended to optimize decision making by emphasizing the use of evidence from well-designed and well-connected research. Guidelines are based off clinicians' opinions or group of clinicians' opinions with little research. Evidence-based medicine provides more of a scientific approach to those guidelines. The Federal Interagency Committee on EMS and National EMS Advisory Council approved the National Pre-Hospital Evidence-Based Guideline Model process. The process is a cycle. That's why every few years we get a new set of protocols and things like that, because it's a cycle. The National Pre-Hospital Evidence-Based Guideline Model consists of system inputs, guideline initiation, EMS evidence accumulation and evaluation, establish priorities for guideline development. Then you have the guideline development itself and EMS protocol development. That's kind of how the model is set up. Then you got the dissemination of those protocols and guidelines, the implementation, evaluation of the effectiveness and outcomes, EMS evidence accumulation, and repeat. So, and again, that's how we have changes in our protocols every couple of years. It's a cycle. They go through all these things. They go through all the different steps, and when they get to the end, they are collecting EMS evidence and they're analyzing everything after they've implemented the new protocols, and they look at its effectiveness, or did it help, or did it make the patients worse, and then they make adjustments and they repeat. National Association of State EMS Officials. Many resources can be found through the NASEMSO. They provide information on current evidence-based guideline projects and they help individual states, regions, or even local agencies. National Model of EMS Clinical Guidelines. These were created for use by state, regional, or even local agencies. They can be used to help form protocols. Version 2 of the guidelines was released in 2017. 15 new guidelines were added at that time. Current focus is on pediatric patients, pain management, and in the pre-hospital setting. They did get a grant that was awarded. 5 states were included in the project with mandatory protocols, voluntary model guidelines, or no statewide guidelines. Benefits. So how do we benefit from evidence-based medicine? Interventions for EMS were not always based off research. We just did it because that's how we've always done it. However, we're based off, expert opinions. You got these old docs that's how we've done it, that's how we're going to do it. Can't tell me anything different. In time, some of the interventions were found to be ineffective or flat out causing harm, even death to the patient. CPAP was implemented as an evidence-based intervention. It was shown to reduce nitro administration and may defer intubation, save patients from having to be intubated. And every time a patient gets intubated, it becomes harder and harder to wean them off the ventilator. They become dependent on that positive pressure. So CPAP was an evidence-based intervention that went through that whole process, and they had found that there were some benefits, and that's why it got implemented. Evidence-based medicine does provide a high-quality patient management and a standardized approach. And so that's how we came up with our protocols. And this concludes the end of Module 1.